I'm Hideki Makishima from Kyoto University. Good afternoon. Thank you so much for selecting me as a speaker in this symposium. I'm very grateful for this opportunity to present recent work regarding DDX41 mutations in myeloid neoplasms. I have nothing to disclose related to this presentation. Germline mutations in DDX41 were initially identified in familial adult onset myeloid neoplasms. After that, multiple groups reported various germline mutations in sporadic cases without family history. This disease is now a distinct entity in the most recent WHO classification. Some findings, such as long latency and frequent second hit mutations, are likely to be true. However, it is not clear which variants are really pathogenic and how are clinical implications, including disease risks and prognosis. In this study, we assessed precise disease risks by simultaneous sequence of genetically matched healthy controls. By international collaboration, we clarified geographical distribution among different countries. By comparison of clinical parameters between DDX41 mutation positive and negative cases, we confirmed clinical implications in disease phenotypes and prognosis. We enrolled more than 9,000 cases with various myeloid neoplasms from 7 countries and sequenced DDX41. This study is larger than any previously reported one. In the whole cohort, 421 non-synonymous variants with allele frequency less than 0.01 in the general populations were identified. Initially, to establish criteria for discriminating between germline and somatic variants, we used Japanese samples with germline control. These are BAF values of 124 variants identified in the training set of 108 Japanese cases with germline control. We established the criteria as shown here to completely discriminate germline and somatic variants. To validate this criteria, we used independent 487 Italian cases with germline controls. According to the established criteria, 24 and 6 variants were predicted as germline and somatic, respectively. Using germline control, it is confirmed that both sensitivity and specificity of our criteria were 100%. Then, we applied this criteria to all the variants. 186 and 237 were designated as somatic and germline origins, respectively. Next, we applied the American College of Medical Genetics ACMG standards and guidelines to germline variants for assessment of their pathogenicity. In total, 208 cases were positive for pathogenic or likely pathogenic DDX41 germline mutations. Main results. As previously reported, more than 60% of cases show both germline and somatic mutations, and truncating variants are significantly frequent in germline mutations. Somatic alone cases were around 10% of all cohort, interestingly representing frequent multiple mutations and deletion 5q or UPT 5q. Overall, truncating germline mutations were distributed in whole DDX41 protein, missense Missense germline mutations were frequently located at Q-motif and dead box domain, and majority of somatic mutations were seen in the helicase domain. International collaboration allowed us to clarify geographic distribution of germline and somatic mutations. As for germline mutations, Asian and European ones were mutually exclusive. In US, European mutations were mainly identified, and some Asian descents living in US shared identical mutations to those found in Japan. By contrast, most of the somatic mutations were shared among Asian and Caucasian populations. These findings suggest that although the data of somatic mutations from different countries can be used for validation, disease risks due to germline mutations should be assessed by comparison to the ethnicity matched population. For genetically matched comparison, we selected patients and controls from Japanese populations. Frequencies of germline variants were compared between more than 3,600 myeloid neoplasms and around 14,000 Japanese biobank samples. 2 truncating and 4 missense variants were significantly frequent in myeloid neoplasms cohort. Once altogether of these risk alleles, odds ratios of predisposition due to DDX41 germline mutation is 13.14. Median ages of wild type and mutant cases were not significantly different, however. DDX41 germline mutations were identified exclusively in the cases older than 40 years. Cases with DDX41 germline mutations were significantly older than those with other pathogenic germline mutations. Among these, DDX41 mutations are the most frequent genetic risk alleles. As previously reported, male is dominant in mutant cases, and most frequently affected diseases are high-risk MDS and secondary AML. In the peripheral blood, WBC and platelet counts were significantly lower in the mutant cases. In bone marrow, nuclear cell, and megakaryocyte counts were significantly lower in the mutant cases. Bone marrow cellularity was also significantly lower in the mutant case. Bone marrow examination revealed that myeloblasts and erythroblasts increased in the DDX41 mutant cases compared to wild type cases. In the clinical course, DDX41 mutant cases showed significantly higher incidence of leukemic transformation, although leukemia-free death is less frequent. To clarify the genetic mechanisms associated with such hypocellular leukemia, we investigated somatic genetic events and clone sizes. In the DDX41 mutant cases, the number of somatic mutations was significantly higher than wild type. However, the number of copy number alterations was lower in the mutant cases. Altogether, the numbers of genetic events were almost equal among wild type and germline and somatic mutant cases. When we compared clone sizes with somatic mutations, mutant clones in cases with DDX41 somatic mutations were significantly smaller than cases without DDX41 mutations. In addition, adjusted buff values of co-occurring mutations were significantly lower than those of DDX41 somatic mutations, suggesting that somatic DDX41 mutations might have a suppressive effect on clone sizes of the cells with later acquired or occurring mutations. Finally, I would like to show prognosis. Because of higher blast counts, IPSS-R is significantly higher in DDX41 mutant cases. However, CCSS is significantly lower in the mutant cases. In fact, overall survival was significantly longer in DDX41 mutant cases. Particularly, hypomethylating agents significantly improved overall survival in mutant cases, which was also confirmed to be significant in the cohort of the cases with biochemic transformation. Similar results were already submitted to a major journal by Dr. Nanya in our group, who analyzed the independent cohort. Today, I presented several new findings we recently identified regarding DDX41 mutated myeloid neoplasms. Multiple DDX41 genetic events are unexpectedly frequent in cases with somatic mutation alone. Pathogenic variants are various among countries. As for the predisposition to myeloid neoplasms associated with DDX41 germline variants, the combined odds ratio is around 13. DDX41 mutations are associated with higher incidence of leukemic evolution, but longer overall survival. Hypomethylating agents might improve prognosis in DDX41 mutant cases even after leukemic evolution. I really appreciate huge support from Professor Ogawa and lots of samples from clinical information from the patients and clinicians all over the world. Thank you so much.